So, normally do this bilaterally, but I'm only going to do it for one for the video. So, get started palpations. This is the quadriceps muscles all here. And then the sartorius muscle goes from here and attaches medially. And then there's the quadriceps tendon, which is right here. It's where all the quads go and extend down to the tendon. And then there's a patella, and then the patellar tendon, which attaches at the tibial tuberosity, which is right here. And then the lateral, I'm gonna find the joint line. So this is the joint line right here, and the lateral meniscus is on the lateral side of the joint line. And then we have the popliteus tendon, which is posterior to the LCL, and the LCL is here. So we have the popliteus tendon, which is posterior to that. And then we have the biceps femoris tendon, which is just right here. And then we have the IT band, which comes all the way down the side of the leg and attaches here. And then we have Gerdy's tubercle, which is where it attaches, which is on the tibia, and it's this little spot right here. And then we have the medial joint line right here with the medial meniscus. And we have the medial meniscus sits on the medial tibial plateau, which is on the tibia. And then we have the pes anserine tendon, which comes across here, and the pes anserine bursa, which is posterior to that. And then we have the medial femoral condyle, which is here. And then we have the gracilis muscle, which is here. And then we have the semitendinosus tendon, which is here. Okay. And then we have the hamstring group. So flip over. The hamstrings are here. These are the muscles behind your leg. Then we have the popliteal fossa, which is here. And then we have the heads of the gastrocnemius, which are right here. Okay, flip back over. So I'm gonna start off with active range of motion. So I'm gonna have her bring her foot to her butt, which is testing flexion, and then put it back out for extension. So now I'm gonna measure them. I'm gonna put the stable side. I'm gonna line it up with the head of the fibula there. Okay. So first I'm gonna measure the extension. Line it up with the fibula. And she is at almost at 0. She's at 1. And then I'm gonna line it up again and have her bring her foot to her butt. And she is at 136. So now I'm gonna do passive range of motion. So I'm gonna do the motions for her. So I'm gonna do flexion and then bring her back into extension. And then I'm gonna do manual muscle testing. So I'm gonna have her come to the edge of the table. I'm gonna test extension first by stabilizing here and holding here, and I'm gonna have her push up against me. Okay, and then I'm gonna have her flip over, and I'm gonna test flexion, and I'm gonna stabilize here so she doesn't pull her leg off the ground, off the table, and bring her foot to her butt. As I apply pressure. Good. So that was manual muscle testing flexion. And then I'm gonna go into special testing. So first I'm gonna do the sweep test, which is like this. And this test tells me if there's any swelling in the knee, or if it jiggles or anything when I touch it or play with it. It would be, there would be fluid in the knee. And then the bloatable patella test is similar, so I go like this, but I just push down on the patella, push it down like that, and if it springs back up, or if it rebounds, I should say, it tells me if the patella is floating, so that would mean that there's moderate to severe joint effusion. So next, I'm going to do the Nobel's compression test. So I'm going to have one hand here. I'm going to hold this. This way. And I'm going to just bend the knee and apply pressure to the IT band on the lateral side. And if there's any snapping or friction or anything, if there's also like pain or discomfort as I push on the IT band while doing that motion, it will mean that it's IT band friction syndrome. So next I'm going to do Godfrey's sag test. So it's also called posterior sag test. So I'm going to hold her leg at a 90 degree, and I'm going to hold her foot here and stabilize here and see if her patella goes down while holding it this way, or if there's like a big indent right here or anything like that would indicate a PCL tear. So now I'm going to do posterior drawer test. And I put my thumbs over the joint line and I push posteriorly. And if there's any excessive movement or laxity and I don't feel that endpoint, then that would be a positive test for PCL tear. Now I'm going to do it anteriorly and test the ACL, and if there's any laxity or anything, that would be mean there was a sprain of the ACL. Normally I would be doing this bilaterally, just a reminder. So now I'm going to do another ACL test. I'm going to put my knee under here so she can relax her leg, and I'm going to stabilize with this hand and pull anteriorly with this hand, and that is testing for laxity. And if there is a positive sign for laxity, that means there is an ACL tear. So now I'm going to do valgus test. I'm going to push in here, and if the medial side of the joint opens up, or if there's like increased laxity, that would be an indication of an MCL tear. And for varus, I'm going to hold here and push this side, and if the joint opens up, or if there's like increased laxity compared to the uninjured side, then that would indicate an LCL tear. So now, the next special test is the lateral pivot shift maneuver. So I'm gonna internally rotate the tibia by internally rotating her foot, and I'm gonna hold here and just push in. And a positive test for that would be if the tibia goes backwards, or clunks or something, it would be anterolateral rotatory instability. There you go. And then we do the Slocum drawer test, which is this one. So I turn her foot inwards, I sit on it, and I'm gonna do the same thing as anterior drawer. So I'm pulling anteriorly, this one is testing the ACL along with the LCL. And then I'm gonna turn it externally, and I'm going to test, gonna do the same thing again, which is testing the ACL and the MCL. So now I'm going to do Houston's postero medial drawer test, which is the same thing. So I'm gonna go here and I'm going to rotate the tibia internally, and I'm going to push backwards this time, which is testing the PCL and MCL, and then I'm going to turn it externally and push backwards, which is testing the PCL and LCL. And a positive sign for the Slocum's and the Houston's medial and laterally would be laxity, or when I don't feel the end point, if it just keeps going with extreme movement. So now I'm going to do Thessaly's. Stand up. Okay, stand on one leg. Give me your hands. And I'm going to turn you this way. And I'm going to turn you this way. So what I'm doing now is having her put pressure on both the medial side of the meniscus and the lateral side of the meniscus when I turn either way. And if she feels pain during that, or if her knee locks or anything, it would indicate a tear of the meniscus. So sit back down. Now I'm gonna do McMurray's. So I'm gonna go here. Can you lay back? I'm gonna go here, and I'm gonna go in, and I'm gonna go out while I rotate the foot. Like this. And if there's any pain or locking while I do that, it's an indication of a meniscus tear. So now I'm gonna do the last meniscus test, which is Apley's compression and distraction. Flip over. So I'm gonna go like this, and I'm gonna stabilize here, and if I push down and turn it internally or externally, if there's any pain during that, then that would indicate a meniscus tear. And if I pull up and it relieves the pain, that would also be another positive sign of a meniscus tear. So now I'm gonna go into myotomes and dermatomes. So I'm gonna have her close her eyes, and I'm gonna test L1. So close your eyes. Okay, so this will be soft and this will be hard, and you tell me which one I'm doing, okay?
Hard. Soft.
Okay, so that was testing L1. Now I'm going to do L2, which is here.
Soft. Shit, soft.
Okay, now I'm gonna do L3, which is here.
Hard. Soft.
Okay. Now I'm going to do L4, which is here.
Hard. Soft.
Okay. And then L5, which is here.
Hard. Soft.
Okay. Now flip over.
Oh god, some practice.
And now I'm going to do S1.
Hard. Soft.
And S2.
Soft. Hard.
Okay. Now sit back up. Okay. So that was testing dermatomes. So now I'm going to test the myotomes. So I'm going to have you go into stand up. Hip flexion, so just bring your leg up to flex your hip. Okay. And now I'm going to have you, that's testing for L1 and L2 myotomes. And for L3, I'm going to have her do knee extension, so put your leg out and extend it. So that's knee extension. That's for L3. For L4, you can sit back down. She's going to do, let's go back. She's going to do ankle dorsiflexion. And then for L5, she's going to do great toe extension, which she's doing. And then for S1, she's going to do plantar flexion. And S2, she's going to do knee flexion. So, yes, if she was not able to do any of those, that would be a positive sign. So now I'm going to test the reflexes. L1 does not have any reflexes, but L2, 3, 4, and 5, the reflex is the patellar tendon. So I'm going to tap there and see if her knee extends out. And now I'm going to do Achilles. So lay on your stomach. The Achilles reflex is for S1 and S2. So I'm going to tap here. Okay, it's not reflexing. There it goes. It should plantar flex when I hit it, which it is. So that's good. Okay, that's it.